Item 13, which is our home visiting expansion feasibility report from our Social Service Agency of Office of Children and Family Policy and the Public Health Department regarding this partnership between county and First Five.
So Dr. Sarah Redman on behalf of the Public Health Department, and I'm joined here, let's see if I can get her title right, Heidi Emberling. Dr. Heidi Emberling is our SSA's Director of the Office of Children and Family Policy, and Jennifer Cloyd Kelleher, our Chief Executive from First Five and close partner in all of this work.
My name is Brenda Garcia Lujano, and I'm here representing Somos Mayfair. We work directly with families through our Family Resource Centers and our Parent-Child Plus Home Visiting Program. And we strongly support expanding home visiting because we see the benefits firsthand when we meet the families in their home. We build the trust, support parents as the children's first teachers, and we help children develop and thrive along with providing parents with the resources that they may need. But there is a gap that we come across. We need to meet mothers and fathers where they are. Pregnancy and the postpartum period can be essentially vulnerable time for families, and parents need accessible, trusted support that connects to their everyday lives. We also know that expanding home visiting requires building a strong workforce. Somos Mayfair is bringing community members into early learning spaces, providing mentorship and hands-on experience, and creating pathways into early childhood careers. We have promotoras who are equipped to do this work. They know our families, understand the community, speak the languages that families speak, and have the trust and relationships needed to meet parents where they are. They can provide education, navigation, support, and connections to resources. The recent death of baby Jackson reminds us that we must continue strengthening the relationships and systems surrounding young children and families. No single program can prevent every tragedy, but reaching families earlier gives us more opportunities for us to listen, identify needs, connect parents to support, and intervene before a situation can become a crisis. So we encourage you to build on what is already working in our communities and create a continuum that supports parents, children, and the people who serve them. And we urge the county to move forward with a concrete plan to expand home visiting and meet the families where they're at. Thank you.
My name is Nayeli Sedano, and I'm here today representing Somos Mayfair. At Somos Mayfair, we work alongside families every single day, and we know that the earlier we connect families to support, the stronger the outcomes are for both parents and their children. There is a clear gap for families during pregnancy and the early years, specifically families experiencing housing instability, poverty, food insecurity, and other challenges. And these families need support that is accessible, culturally responsive, and rooted in trust. We support the county's efforts to expand home visiting because it is an opportunity to meet families where they are at and build relationships early, connect parents to resources they need before challenges become crises. We also encourage the county to recognize and invest in community-based organizations and trusted messengers already doing this kind of work. Promotoras who come from and understand the communities that they serve play an important role in building trust, reaching families who may otherwise be missed, and connecting parents to services and resources. Expanding home visiting should mean building on what is working, not creating parallel systems. And as community partners, including promotoras and other trusted community members, we are ready to help build a stronger continuum of support for families. And we urge the board to move from planning to action and develop a concrete, equitable plan to expand home visiting across Santa Clara County. Thank you.
Thank you all for your work, not only on this report, but for your ongoing passion for advancing the well-being of our youngest residents. I want to begin my comments just by recognizing how far this project has come. In 2023, I directed a budget inventory grant to First Five Santa Clara County to conduct a study of the home visiting services that were then being offered across multiple systems in our county. That report was completed in 2024 and provided a detailed analysis of funding sources, service needs, gaps in the current landscape, and recommendations for expansion. The findings were clear and unsurprising. Home visitation services in the county were both underfunded and underutilized. The report also underscored that home visitation is a cost-effective investment, bringing together case management, family support, and critical referrals to other healthcare providers. So again, I just want to express my deep appreciation for the research, the collaboration, and the thoughtful discussions from county administration and our partners. Your commitment and your creativity have been essential to identifying opportunities to keep this work moving forward, even in this very challenging fiscal environment. I also appreciate the alignment that this work has with the Latino health assessment that my colleague, Supervisor Arenas, is leading so beautifully, particularly around expanding the critical work of promotoras and community health workers. As a next step, I'm interested in pursuing support for a home visiting model using the community health worker and doula benefits.
Doulas are experts trained in the entire perinatal birthing process and postpartum period and early infant care, and have been an absolutely vital element of how we have helped people survive and thrive through pregnancy and early postpartum periods for it's often based on learning we've had for decades and maybe centuries. But it's only relatively recently that DHCS acknowledges that these experts should be reimbursed for the support they offer during pregnancy, delivery, and postpartum care. And so for those who have Medi-Cal, there is a covered doula benefit that just began about 3 years ago now that includes an initial visit and then up to 8 follow-up visits in any combination prenatal and postpartum care. One of the things we see that this benefit is massively underutilized in general, that it can offer a particularly supportive, culturally appropriate, and empowering experience for birthing parents and the entire family, and that it's especially underutilized in the postpartum period. People who do enroll in the benefit and do use it leading up to birth and during labor and delivery often don't use their unused visits after, during the period when, as this legislative report provides, we know that is a critical period when families need support. So one of the many solutions we're pursuing is making sure that that benefit is fully utilized by those who have access to it.
Have we reached out already to community organizations that are billing for doula care?
We've begun to do so. On the public health side, our main partner is Roots, that we work with explicitly on our perinatal equity initiative, and in making sure that folks have access to the doula benefit in that way. But I'll look to my colleagues to see what else we're doing to enhance access to that benefit.
Thank you.
There we go. In our meetings with the managed care plans, we sort of asked about doula availability, and that is the other challenge, is there are not nearly enough doulas, and those that are in practice are often solo practitioners, so there are not a lot of organizations we learned that have doulas on staff in the way that Roots does, and even the Roots program is a kind of a fairly newly launched and developed program that was actually seed funded through the Santa Clara Family Health Plans Board Innovation Fund to sort of try to build a larger stable of available doulas. So at the moment, there aren't a lot of community-based organizations with doula contracts.
Sorry to interrupt. Does it have to be community-based? Could we put out a call for doulas that might like to participate in a program? And is there a workforce development piece? Are our community colleges in San Jose State offering doula certifications?
So I can't answer the doula
That's fine.
certification.
Sure, that's
aspect.
totally fine.
I don't know.
I'm just musing.
We did talk about the training and certification process with the managed care plans. And interestingly, the doula certification process is actually a shorter process, according to the managed care plan, than the community health worker certification, which was surprising to me.
Interesting.
And we did talk with them about their interest in potentially developing sort of their own pathway. But that we did not, explore deeply what is available in terms of the certification, and that's somewhere I think we can explore.
Thanks. And then to the first question, do they have to be associated with an organization, or can we partner with individual doulas, and if they're not already billing for Medicaid, help them begin to do that?
So my understanding from the managed care plan is they do not need to be through an organization.
Oh, great. Okay.
And in fact, the ones they have are often, as I said, sort of solo practitioners. I can't answer the question about the billing because that is a heavy lift.
Sure. Right.
And so I don't know enough about how the individual practitioners are managing that billing process, but perhaps because they're also billing insurance and other ways they have some of that infrastructure. But
Right.
that's a good question.
Okay, good. So I don't need anything more specific right now, but want that to be kind of in the next stage exploration to see if we can expand that because there is money for it. And it's in fact, we do not believe that it is funding that is threatened in any way. So it feels like, for the moment, a reliable source. The report concludes by noting that administration will continue to partner with First Five and managed care plans to develop a feasibility and cost plan. I think that's what we are starting to talk about. But can you talk me through any other next steps in this process, including whether there'll be an opportunity for CBOs already billing for community health workers to be involved in the plan?
The lowest hanging fruit would be to partner with CBOs that are already able to bill Medi-Cal. So
Sure.
we have the list from the managed health care plans, and that is the group that we will convene first to talk about moving this forward. We're working with the managed health care plans to outline what would the cohort look like of people taking the community health worker certification. They actually just mentioned the doula benefit in our very last meeting that we had with them. So we haven't really started exploring that, but we were talking about who else goes in, aside from promotoras, community health workers, to see families with new babies in terms of home visiting. They were like, well, doulas, they go before and after, during the pregnancy. We're like, yes, what about doulas? So I think
Great.
we put it in, but it is initial exploration. That was our very last meeting, so we're very happy to have another area of exploration. And they did say the doula benefit is higher than the community health worker benefit. So it is a pathway to a higher reimbursement rate than community health workers. So I think if we pursue both, there will be two avenues to expand home visiting that is covered, partially at least by the Medi-Cal benefit.
Great, thank you so much. And I know that we are anticipating receiving the feasibility and cost plan for this work at the second meeting in January, correct?
Exactly.
Fantastic. Then my motion today is simply to receive the report, and thank you once again.
Second.
Thank you for the second.
Home visitation is one of the ways that we can really mitigate and support, mitigate a lot of issues that our families are facing and obstacles that they're facing, as well as be a support system for young families and all families. It doesn't have to be just young ones, but anybody who has children that are maneuvering through this society post-pandemic and just in this new modern age. And so this is really amazing to me, the fact that we're looking at different pathways to either the community health workers or the doula pathway. And I dare for you to maybe even think of another pathway that could bring in the men. And this is one of the things that I think about when we have babies. We have fathers that are involved in the lives of our children, and who is talking to them about their role as fathers and how to support moms and how to be supportive dads as they're growing in their role as well. I know we talked a little bit about this, and I'm excited to see this role actually grow a little bit more than what it normally does. I mean, we've come a long way from the 50s where men weren't even allowed into the room when we were having babies, and now,
Wow.
I
I cut the cord 3 times.
Yeah. Well, that's where they smoke cigars out in the hallway, and I don't know what they did in the 50s, but nowadays men are right there with us, right? And the fathers are taking the level of responsibility that is just amazing. And sometimes we unintentionally leave them out. because a lot of the program is focused on the women and the moms. And so I'd love to hear if there's any thoughts so far about how to incorporate or how to create a pathway for our men to be involved. I think it's you, Jennifer, you're trying to.
Yes,
love
thank
it.
you for that question, and I also, as a mom, 100% agree. One of the great things, at least about the Parent Child Plus program, which is the program that's being offered for children that are 2 and up, is our providers that are offering that program in the community, Rebecca's Children's Services, Catholic Charities, and Somos Mayfair, do have some very strong programming in fatherhood initiatives. I think Somos in particular has been leading the way with fatherhood work for quite some time. And our agencies, one of the reasons why we implemented Parent Child Plus in the way that we did through these existing agencies that have deep benches of other programming and services and support, is that the navigation component of Parent Child Plus hopefully really brings in other aspects of the programming. But one of the things that I think is especially effective about a home visiting program is sometimes for a dad to raise their hand and sign up for a class and show up and, oh my God, are there going to be any other dads there, is a big step to ask and can be a big stigma. So I think the fact that our home visitors are in the home, having dads come on into the room and get involved are really a good entry point for dads to get more involved. We will talk in more depth, and we did reach out after your question to Parent Child Plus's headquarters to talk about sort of their fatherhood programming, and they have actually been seeking some specific grants to enhance the curriculum around fatherhood in particular. It's not yet built into the curriculum outside of just the normal, every parent is a parent, but I do know that's something that the national headquarters, and it is an evidence-based program, are really trying to integrate across, regardless of which agency is implementing the program.
I love that. I really love that. I know that sometimes inviting the men into the living room or wherever you're at is a really good effort, but I think that we also need to figure out how to bring in the workforce. And I know that Supervisor Ellenberg talked a little bit about the workforce development. We have these paths of community health worker, we have a path of a doula, and if doula, we get reimbursed at a higher rate and it is an easier pathway, then I would probably encourage that pathway a little bit more so we can get folks into the field, and then default to whatever pathway you see best fits home visitation. But I'd also love to see a pathway that is explored for the men who are working in the programs, and so that it's not naturally, an inclination is for women to step into these roles, right? It is not natural for the men to step into these roles, and so I would really love to see how can we grow that in a very significant way, not just to invite the men into the living room, but then have those workers be the men who actually recruit, because you work from what you know, and people love to see themselves in others, and when they are served in a culturally appropriate way, we already know this, will render more participation, and that's ultimately what I would love to see. And also just acknowledge that role. That is a very important role. Mother's Day is always, a blast, and then here comes June with Father's Day, and I've heard one too many times, it is a forgotten holiday, almost, right? And it shouldn't, right? It shouldn't be, because father roles are so important for our children, and in however the family looks like. So in all the genders that are included. And so I hate to just focus on men, but I think we haven't. So that would be my ask. And I don't know if maybe I need to integrate this somehow into the motion or just ask for that direction to be followed. Wonderful. I'm excited. I'm really excited. I'm excited. This is... First of all, financially, fiscally, it makes so much sense. It is very affordable And it's an investment that I think we should continue to make, and it would be crazy if we didn't continue to make these kinds of investments in home visitation. Yeah. Jennifer, did you have something?
No,
Yeah.
just trying to turn my mic off.
Well, I will too.
Thank you.
And just
yes.
thank you all for the hard work. Thank you.
Thank you so much. Thank you for this very thorough report. I appreciate the background research on existing models and your analysis of the options before us as we look to expand home visitation services, programming, and this incredible opportunity for workforce development. It really runs full circle in terms of rooting care and community and also economic inclusion and empowerment of the folks who are best positioned to have this interaction and engagement with our families. I really appreciate the comments, the points brought up today, especially about the participation of fathers. It reminded me of some feedback I received from some of our healing circles that's hosted at the VAS, where fathers and partners are asking for help and guidance of how to support their partners, new moms, through postpartum depression. So that was something that has become more prevalent, and the feedback that our office has received recently, which is a positive thing that our male partners and our fathers are leaning in to that understanding of care for mom and for baby. So I want to highlight that, and I really appreciate the conversations about workforce development. I do want to echo my support of opportunities for expanding and exploring how the community health worker hub and model can be a catalyst for careers as community health workers and home visitation professionals, including doulas. Also, I've seen other models, and I've seen references made to also medical assistants, in-home support service providers, phlebotomists, community workers, community liaisons, peer support navigators, being able to also emanate from the community health worker model. So I'd love to, as we progress on this work, like, what are the possible avenues of expansion in those areas and other things we may not be listening or not thinking of right off the bat, right, as natural progressions. Supervisor Elmer, I really appreciate your comments about questions about the medical billing for doulas. I know that we don't have an answer today, and it just right now reminded me of a very visceral memory I had of meeting a constituent at one of my meet and greets, and she is a doula, and I think we spent about 45 minutes, not me talking, me listening. She was giving me the challenges of medical billing as a doula, who is in contract with our county health system. So happy to connect if there's an opportunity as you look for more engagement and understanding more, the research part of your work, if that would be helpful to connect our constituent to your work in terms of the feedback she has for medical billing and reimbursement billing or service billing for her doula services. Very passionate. And then I want to switch over the descriptions of other models in the report, and LA and Yolo counties and existing models here in Santa Clara County were very helpful additions to this report. I want to thank the staff for that. I recognize it's no easy feat to pull that much information and to synthesize it for a board presentation and discussion. I am curious though, and this, I trust that this will be an ongoing conversation. I know that the home visitation doesn't happen automatically. You call the family, you present the program, you ask for permission. Can we come provide this home visit? Can we coordinate with you? Then the mother, the parent accepts, and then the coordination happens. I have received inquiries, concern from some of my constituents not fully understanding this program, the nature of this program, for whatever reason. There is a misconception out there that this is another point of engagement, but like to pull me into the system. To pull me into a system, or as one constituent put it when they reach out to my office, is this to judge my parenting, or is this to judge my character? We know the benefits of this program. We also know that there's a landscape, an environment of misinformation out there, and also a history of the child welfare system not being necessarily the place to provide support for parents who may be struggling, who may need more prevention and support than they do need before the problem or the challenges become something that's unmanageable. So I wanted to share that with you, share that with you, and also very curious, very interested in your thoughts as this conversation continues of how we can ensure that expanded capacity for home visitations doesn't have negative unintended consequences or have this misperception that this is anything other than providing support, making sure the family has what they need and that baby has every opportunity possible. I recognize the benefits of this program. I fully support any and all expansion of this program to all families, and we are going to have to contend with some misinformation or misperceptions out there.
Well, if I may, thank you for your question, Supervisor Young. I think there are multiple strategies to overcome exactly what you're describing, some of which go all the way back to how do we engender and frankly earn trust of government organizations enough to not just have the, honor of interacting with someone during the valuable time after they've given birth and are raising a baby, but to step into their home. And that trust starts long before a referral to these programs happen and needs to be carried through the incredible quality of the services we provide as a county and our reputation as a county government. I think some of the ways when we have been successful have happened in where the initial referrals come from, often with a trusted healthcare provider saying, I'm going to connect you with this program because being a new parent is hard for everyone. There is no one with all the resources in the world who has not, at 2 or 3 o'clock in the morning think, what am I doing? And so just recognizing that that's why we're there to help you have backup in that opportunity and have a trusted nurse or doctor be the first to tell you, or doula, be the first to tell you, we want to bring this support to you at your home in a time when it's going to be very hard to leave. And I think the second is working with community organizations that already are deeply embedded in the communities that they're working to serve. That's why partnerships with First Five, with Catholic Charities, with all of our service providers who don't, as Jennifer was describing, just do this home visitation work in the postpartum period, but are out there connected with their community in a wide range of roles. That's really how we get it done. But I think to your point, we are still fighting an uphill battle to continue to earn that trust as a government agency based on what our community members feel and experience from other governmental agencies. And it's a challenge I think we continue to face with partners like First Five. Jennifer, anything you would add?
Yeah, the one thing I'll add is just talking to our partners who operate some of the programs referenced in the report, that automatic light touch referral process that they implemented in a couple of other counties have really resulted in lowering the stigma because everyone is offered the home visit. So it's in the same list as you come back 5 days from now after you leave the hospital for your first postpartum visit. So it really lowered the stigma, and they found that the uptake and acceptance of the home visits were almost 100%.
Fantastic.
So that really, if we can get there, if we can build the infrastructure, it really does minimize the stigma, and then it also helps us identify, the families that really do need more intensive support, and we can match them to the right program versus the families that, have 3 visits and are off and running and feel secure. So it's also a really cost-effective way to stratify the intervention, because right now we only have high dosage intervention home visiting. So, Parent Child Plus is almost a 2-year, 1.5-year program, similar with Nurse Family Partnership. So these are really intensive investments. They're hugely valuable, but there's so many other families that could benefit from something shorter, lighter, less expensive, and less stigmatizing. The other thing our team and my First Five team that did the report is sitting behind me. They did all the work.
Congratulations, thank you.
And one of the other recommendations, we discovered was when and if we do have, more robust opportunities availability for home visiting, a public awareness campaign about what it is would really be beneficial to match sort of the availability of the service. And that's certainly something, First Five and Public Health could collaborate on, just to help people understand it is not a monitoring arm of child welfare. It is hopefully a preventative arm to keep people out of child welfare. But those are all, I think, opportunities we could build in alignment with the expansion. Right now, if we did a big campaign, unfortunately, we'd probably send more people to a wait list. But that's absolutely something we think would be beneficial down the road.
I really appreciate the thoughtful considerations being made, and I'm really happy to hear. You've affirmed what I was hoping for, that we are cognizant of this landscape, this challenge, where there are parents who are afraid to engage the county for help for fear of losing their child, or going through a process that they may not belong in, right? What they really need is prevention and support. Happy ending, the constituent that called our office did in the end accept the home visitation, and they actually let us know that it went really well, and they felt better about it. Last thing I'll say is that I really enjoyed reading that stronger connections we made between the proposed Community Health Worker Hub and the efforts to expand home visitation services. This is exactly the opportunity that I had hoped for with previous comments and discussion before this body. Thank you so much, and thank you to the staff for this very thorough report. Look forward to the future.
Supervisor Abikuga.
Thank you, President Lee, and thank you so much for the report and all the great work, and thank you, Supervisor Ellenberg, for your championing this really great initiative. I agree. I think this is home visiting is. I think about my first experience 25 years ago and how my husband and I were so scared to go home when they released us from the hospital, and my older daughter, my first daughter, actually ended up having a high bilirubin that ended up in a blood transfusion that we didn't know about until we had our 1 week visit. And I think had we had a home visit or had this opportunity, that could have been, caught earlier, and all of the treatments after could have been prevented. So I do think this, in an ideal world, everyone should be able to have this opportunity. I do appreciate the comments about the doula program, and this morning our invocation presenter actually is a doula who founded the volunteer program at Santa Clara Valley Medical, and also is part of, was the Blossom nonprofit that looks like a very well-established organization. So I see that there's great opportunity for partnership. I had asked this question in writing about workforce development opportunities and working potentially with our community colleges. I understand that you are exploring through other health-related certifications, but also just thinking, can we even, initiate, and maybe you already have, conversation about starting a certification program. I know like Foothill De Anza in my district has been very supportive and really looking for opportunities to provide more workforce development programs, not to speak for them, but knowing that, I just wanted to see how those conversations might be going.
I'll start and then pass off to Dr. Emberling. Thank you for that comment, Dr. Supervisor Abikoga. Also a Juris Doctor. Doctors everywhere. We have a longstanding history in the Public Health Department of collaborating with some of our universities, specifically around nursing workforce development, and I think it's exactly those pathways that we could leverage for thinking about the doula certification. I also think there's an opportunity through the Community Health Worker Hub, which really is meant to be both a career pathway support system in itself and the opportunity to then benefit the entire community from those new career community health workers, to forge that kind of opportunity for career growth and to expand and hopefully resolve the problem we've been hearing about, the lack of doulas overall, because it is a fabulous career opportunity and one that is certainly under-leveraged. So sorry, Dr. Embley.
So in our research, we did look up all the community colleges in Santa Clara County to identify the programs for you in the report. The managed healthcare plans do underwrite cohorts in the community health worker certification. I believe right now they're working with Mission College. I can't remember, but I think it is Mission College. So I think if, again, we're trying to be innovative and crafty in how we partner with those that might have access to additional funding sources. So I think working with the managed healthcare plans around the cohorts they're already sponsoring and making sure that our promotoras and other home visitors interested in the community health worker certification pathway can be folded into these cohorts, I think is a connection that we want to build on.
And the only thing I'll add is this is more related to once folks enter the home visiting field, because there isn't necessarily a particular required certificate. But one of the things we've been doing at First Five through the Home Visiting Collaborative is providing professional development that has been requested by the field as a whole. So we've added some additional training and support on early childhood education. We've provided some additional training in specific areas that have been requested. So we've been doing that through a variety of budget dollars, through some funding we were receiving from First Five California, but that is definitely an articulated need. And the field, again, varies broadly between folks that are public health nurses and folks that are, coming from lived experience, having, for example, participated in Parent-Child Plus and have now been trained in the curriculum and are offering the home visiting themselves. So there's a broad range of professional development needs. It isn't necessarily addressing your question about building the pipeline into the field, similar to Supervisor Arenas' question as well, which I think we can talk about more.
Okay, Vice President, last question.
Sure. Lastly, I actually was thinking about it as Supervisor Abacoga was talking about 25 years ago. I also 17 years ago. And my son was born really early, and so he stayed in the hospital for 2 months. And I also thought, why are you giving this baby over to me? Because he's very medically fragile at the moment. He is 6'3" now, and football on the football team for a couple of years now in high school. In retrospect, I think, and I was talking to Supervisor Ellenberg about this, it's I would have loved to have a home visitor now. We had early start, but that was more physical therapy and things, just physical things that we needed to address. But it would have been nice to have something a little bit short term, right? I didn't really need a long-term home visitation program, so I think this would have been perfect. And so I think about some of those other children and the families who might have, and I know the public health nurses probably would be assigned to the more medically fragile, but those that are kind of in between in the disability community, I think, need to have a special focus. And so will the community health workers or will the doulas, or which of the tracks will be more focused on, I don't think severely disabled, but those that might have some issues that need a little bit more support?
I can take a first pass to say that and thank you, Vice President Arenas, several of the programs that public health supports do have this focus on medically fragile or children with disabilities, families impacted by disabilities. One of them, for example, is the CCS, or California Children's Services Program, which requires as a qualifying criterion not only lower income status, but significant medical conditions or disabilities. And with that is a case management, a occupational and physical therapy, and an integration into some of our other home visitation programs for those families. Now, for the community health worker work at the direction of yourself and the board in our expansion work coming out of the Latino Health Assessment, the community health workers themselves were describing a need and a desire to learn more about supporting families with disabilities. And so that is an intention of the burgeoning Community Health Worker Hub, the training we wish to foster and connect people to really be able to bring not only our nurse or other professional experts who do home visitation to support these families, but also our community health workers as well.
Wonderful. I love that they have found that integration, but we also should have it as the North Star, somewhere in between, right? Not severely disabled or with needs, but somewhere in between that light touch that we talked about. And I think that's really important so we don't forget. And in anticipation of some of those issues, I think that having somebody in the home can answer questions about what is typical and non-typical, right? And that can range in and of itself depending on what area we're taking a look at. So I'm glad that you're thinking about it. I'm glad, and I'm hoping to hear a little bit more about how you will integrate that and how you'll distinguish that from some of the other very well-established programs that are meant to support the already established programs. But this is a little bit different, right? And so who will we be able to focus on? And I'd love to see as I knew it, and I don't know what it is now, but those kids who are entering our first 5 system of care, there's some of those who may not need a long-term home visitor, right? And that may need a more of a light touch. And I just love to see what that looks like in real life, in real life examples, like how do we distinguish that? And I hear the concerns from Supervisor Young to figure out, like, wait a minute, is this to evaluate me or is this to support me, right? And I think that you're very cognizant, all of you, all 3 of you are very cognizant of that need. And I think that the way that we train or the way that folks are going to come through the workforce development tracks and whatever tracks we establish, that they will also be cognizant of this and will use language and interaction and engagement strategies that will hopefully relay that we're there to be supportive. And so, knock on wood, everything, I don't even have to knock on wood. I know that between you 3 ladies, you'll have the foresight to make sure that we have a different kind of an engagement. And I'm really excited about this. Thank you.
Thank you very much. We've got a motion with second. As a father of 3 daughters, I went through I have not, of course, given birth, but so I've gone through the like I said, I cut the cord 3 times, the umbilical cord, literally. I'm still trying to do that figuratively, but that's a different issue. But at the same time, the word doula is something I really didn't know about until we had our firstborn, and my gosh, without that, I didn't know what I was doing. And at the same time, the issue of postpartum is not an issue of even economic. It happens to everybody, and we went through that very, very heavily myself, how that affected, and that many of my friends have as well. So I just want to say this is a very important issue, and thank you so much for the amazing work you guys are all doing. Awesome. Thank you. All right, without further ado, let's take a vote.
All right, we have a motion by Supervisor Ellenberg, seconded by Vice President Arenas. Supervisor Abaikoga.
Aye.
Supervisor Jung.
Yes.
Supervisor Ellenberg.
Yes.
Vice President Arenas.
Yes.
President Lee.
Aye as well.
Motion carries with 5.